commence this esteemed workshop on rare diseases, we shall begin with the traditional lighting of the lamp, symbolizing knowledge, wisdom, and enlightenment.
We request our esteemed dignitaries on the dais to come forward for the lamp lighting.
But they are not so rare. And what we are seeing in the hospital and tertiary care centers are just the tip of the iceberg. And there are many rare diseases which are hidden. They are not seen out from outside. And that's why there is expertise is needed to explore these conditions and give treatment to these patients. Treatment is very costly, prohibitive, and sometimes not available to all the patients. So our endeavor should be that we can enhance the care through supportive and also the preventive and the promotive health of these individuals. And prevention, that is at the community level, as well as the antenatal diagnosis, are one of the main important lead which can lead to the disease free and also the care for the most of the patient with the rare disease. With this, we are whole day which is dedicated for sensitizing different aspects of the rare disease as part of the National Rare Disease Policy Government of India 2021. And this policy will discuss some of the important aspects, that is how we can manage these patients well and at least they should be free from the disease. Thank you.
I now request Dr. Samir to address the gathering.
Talk on rare diseases. So I welcome time to attend this function. So as you have already been told that rare diseases are not so rare, and in all specialties we come across various disorders which have a syndromic or a genetic basis. As far as urology is concerned, in my department, we are planning to start a clinic on various cancers which have a syndromic and genetic basis, because there are a significant number of patients in our follow-up and also that we have treated. So I hope this workshop is an opportunity for all of us to clear all our doubts, clear all the gray areas, and go back more knowledgeable and enlightened. And I hope that this workshop will also be an occasion to interact with the senior people and people with more experience. So I again thank each and every one of you and welcome you all. Thank you very much.
I now request Dr. Shilpi ma'am to address the gathering.
Respected officiating executive director, Dr. Sandeep, Dr. B.S. Charan from the Ministry of Health and Family Welfare, Dr. Mahesh, Dr. Kuldeep sir, Dr. Kavita ma'am, Dr. Pratibha ma'am, all the other faculty, various dignitaries from the Medical Education Department of Rajasthan State, and dear delegates. It is indeed a pleasure and a privilege to welcome you all to AIIMS Jodhpur. And as sir has already said, it all started 2-3 years ago when we applied for the Center of Excellence for Rare Diseases, and there were strict inspections. 2 to 3 times, I think the ministry team came to AIIMS Jodhpur for various kinds of inspection of labs, etc., as well as the infrastructure which AIIMS can provide for being a center of excellence for rare diseases. Since then, the journey began for the rare diseases in AIIMS Jodhpur. Everybody knows that rare diseases, why they were called as rare diseases, because as per the definition, they are very rare in the population. I think less than 0.05% of the cases are detected in the population. But for patients with rare diseases, it is a very long and a difficult journey actually. both in diagnostics as well as in therapeutics. They are frequently passed on between various specialists. They are not able to come to terms with the fact that exactly what they are suffering from with kinds of syndromic disease, which has various complications as well as various symptoms, which they migrate across the cities. Then they finally come to a place where they are diagnosed. And once the diagnosis is also made, the therapeutics become a very big problem, because obviously some kind of enzymatic disorders are there, few things which cannot be treated, and they have a very long treatment, maybe some lifelong treatment, etc. So more often than not, mainly the answers are very elusive type. So as healthcare providers, we have this responsibility to actually help them both psychologically as well as therapeutically, whatever the treatment they are undergoing, and to help them both monetarily also. So there are various aspects to the rare disease which are different from other diseases, except for maybe cancer, that the patient generally are young patients or are kids. Although now the rare disease definition also includes various diseases of adults, but mainly the pediatric cases are more in the rare diseases category, and they have a lifelong treatment. So psychologically, financially, as well as other aspects of the disease should also be taken care of as healthcare providers. So it is a privilege to have such a workshop, which Kuldeep sir and his team has actually worked up, including all the major stakeholders. And I hope you enjoy the discussions which are there, and take interest in whatever the discussions are going on. Thank you so much.
We now request Dr. Mahesh Devnani sir to address the gathering.
Good morning, everyone. Professor Sandhu, Dr. Dikshit, Dr. Charan, Professor Kuldeep, faculty colleagues, and all the delegates and those who are joining us online as well. First of all, welcome to AIIMS Jodhpur. We are delighted to have you here, and congratulations to Professor Kuldeep for organizing this sensitization program. And let me put it on record that the team of Professor Kuldeep, under his guidance, and various other departments are doing very well in the rare diseases, because I interact with him almost on the daily basis. And he is trying to, further strengthen the facilities, not just in terms of infrastructure and manpower, but in terms of, supplies also. And I was just now discussing with Dr. Charan some of the, difficulties that we are facing, or the availability of some of the drugs. And he informed that there are already, a few things that are going on, and the centralized purchases might, commence soon. As Dr. Dikshit said, these are rare diseases, but keeping in view the overall population that we are 140 crores, despite that the prevalence is low, but the overall number is still quite sizable, and their requirements are quite different. And, sensitizing the medical colleges, sensitizing various faculties that are working in different healthcare setups is important, and that is the importance of this organization organizing such type of workshops from time to time. So I really congratulate the ministry for taking this initiative, and Dr. Kuldeep and his team for organizing this workshop. And I hope that you all will go back wiser and will further strengthen the services that all the references to the centers in different departments. Thank you very much.
I now invite Dr. V.S. Charan sir to address the gathering.
Very good morning to respected dignitaries on the dais and those who joined virtually. I'm Dr. V.S. Charan, ADG at Ministry of Health and Family Welfare, Nirman Bhavan, New Delhi. I am one of the member of the team who is looking after this rare disease context, national rare disease policy, and I congratulate and thanks Kuldeep Singh sir and entire AIIMS Jodhpur team for organizing this wonderful one-day workshop and also for inviting me to this workshop. The purpose of this workshop is that under the NPRD, there is one component that we should create awareness among the health professional as well as the public. So it was the thought that first we should go through the health professional and then we will move to the general public. And for creation of the, referral part, to establish a referral system for the rare disease and to create awareness, Ministry has suggested that each center of excellences should conduct one day this sensitization workshop. So at least you will get a rough idea what is NPRD, what all are the component, and what is your role in that NPRD 2021. So thank you once again, sir. Thank you very much.
I now request Sri Amrish Kumar sir to address the gathering virtually.
Thank you for inviting me for this workshop. And I'm sorry I'm not available to come in person. We have many other things scheduled today. So as a health administrator, if I look at this aspect of rare diseases, we also have a budget announcement this year to start a center of excellence for rare diseases in SMS, Jaipur. And so broadly what I've understood essentially is that, see, if we look at it, the whole thing philosophically, modern medicine's quest is to ensure that every human being has a disease-free life. And to ensure that there is a step-by-step progression. So while a particular center of excellence can help individuals who manage to reach there, but if I look at the whole situation as a public health administrator, then my objective is to ensure that any human being who is either born or about to be born is diagnosed at the earliest, whether he is likely to suffer from a genetic disorder. Essentially, all rare diseases are genetic in nature is what I'm told, or largely they are genetic in nature. More than 90% of them are genetic in nature. So yesterday we were discussing that we should have a universal fetal screening program and universal newborn screening program. And so if we do fetal screening and if we figure out that the disorder is beyond a certain magnitude, then MTP is also a possibility. And in newborn screening, if we are able to pick it up early in a child's life, then maybe the prognosis and the treatment will have better impact in the child's life. So from a public health perspective, these are the two things we are considering launching in Rajasthan. Of course, it remains to be seen. We have to figure out the technical and financial feasibility of this whole thing. And so, I mean, our objective is to provide a quality medical care across the spectrum to all citizens of Rajasthan. So I would say that, this partnership with AIIMS Jodhpur in making this happen is fantastic because we can funnel those cases to AIIMS Jodhpur, which we find from rest of Rajasthan for rare diseases. And I was also thinking yesterday that why are we spending so much effort and money on rare diseases when they are so rare? Then I figured that essentially, if you look at it from an individual standpoint, let's say if I have a family member who has a rare disease, I definitely want treatment. So if you look at the entire situation from that perspective, then yes, it is one of the human endeavors to, go beyond what nature has given us and to solve situations which nature has not solved for us. So from Government of Rajasthan, this is our plan. Thank you.
Thank you, sir, for your wisdom, guidance. And we will next proceed to vote of thanks. So vote of thanks by Professor Kuldeep Singh, sir.
So I'm grateful to our chief guest, Sri Amrish Kumar ji, for giving his wisdom and how he has a vision for the Rajasthan. That is how we can give the care to the rare patients and not only that we can prevent these birth of these children with the rare disease through prenatal screening. I think this is what we are also aligned with, and that is what is the national policy on rare disease aims at, to provide the holistic care with the community screening as well as antenatal screening and the newborn screening. So you have just cast these words very well, and I think this will go a long way in managing the patients with the rare disease. And on behalf of AIIMS Jodhpur, I thanks all the dignitaries, Professor A.S. Sandhu, Executive Director, Dr. Mahesh Devlani, Dr. Shilpi, Dr. B.S. Charan, Dr. Kavita Bhatnagar, Dr. Pratibha, Dr. Charu, all the faculty members of the pediatrics, all the pediatric faculty members and obstetrics faculty member from Rajasthan state who have gathered here, and all the students. So let us, together we can win, and the rare is not so rare. We have to care for the rare, and together we will win. Thank you.